My ventricles, contractions still look strong. No fatty deposits. My coronary artery is pristine.
Very healthy heart, Dr. Jaffrey.
You eat a lot of oatmeal, Dr. Jaffrey?
Good one.
I'm ready for the scalpel.
What? Why a scalpel?
I need to divide the azygous vein.
But shouldn't you do the entire dissection first? Say that to last.
She's got a good angle on it now.
Yeah, but what happens if something goes wrong? I mean, good Lord, you won't have enough collateral blood flow to bypass the obstruction.
Dr. Jaffrey, I want to remind you that you're awake to observe this operation, not conduct it.
Oh, sorry. Force of habit. Please proceed, Dr. Becker. Well, surely you don't intend to use a quartering knife.
I thought it would help to...
It'll help her keep ahead of the bleeding while she cuts.
No. You do not touch me with that torture device. Did I fail to teach you proper surgical technique?
You always said it's important to maintain hemostasis.
Yes, after the cutting and the tying of the vessels individually, not charring them with a bloody cautery knife.
There's a lot of cooks in this kitchen.
Yes, well, my well-being's at stake here.
I understand, Dr. Jaffrey. I'm fine. Give me the meds. There. I've got everything. I'm ready to reconstruct the vena cava. Give me a 20mm Dacron graft and a 3/0 proline stitch.
No. 3/0 is far too heavy for a graft this size.
I thought the 3/0 was appropriate.
No. All right, that's it. You're out.
That's enough, Dr. Jaffrey.
It's my heart, and I'll tell you when it's enough. Rhodes. You're in. Take the instruments. Now.
Dr. Latham, I believe that it's time to put our esteemed patient under general anesthesia.
What? No.
I think it's in his best interest.
Look, wait a minute. We had an agreement. Come on.
Alan, if you would please.
No. Alan, you do not. You wouldn't dare. What?
Oh. How about that? So quiet you can hear a heartbeat. Now, Dr. Becker, I believe you were about to sew in the graft with a 3/0 stitch?
Suture and DeBakey's?
Is that a retractor?
How can she even see without loops?
Some people born deaf are more sensitive to light and motion in their periphery.
I know she's got a team to back her, but no loops, no cochlear implant. Not to sound ableist, but damn.
Well, I think they would agree with you. Did you see this, Helen?
It's incredible.
Pushing lidocaine.
Administering later?
Scissors.
Mesenteric artery ligated. There's still water in the basement. We won't need that. Might go up on the O2. We won't need that.
Does Helen seem a little off to you?
We won't need that OPA. We won't need that OPA.
Tumor isolated. Dr. Goodwin, Dr. Reynolds.
Number 4 reverse cutting needle.
We'll get to
Ready
it.
for en bloc dissection. Here we go.
Phase 328. With the regional valve. When the renal shunt functioning.
Time check on those ureters.
Clamping now.
Has E2?
Talk to me.
Perfusion temps are a go.
PTT still within normal range.
All right, hepatics are clamped.
ECT is 418, so heparin is in.
All adhesions free.
Dr. Reynolds, ready to go on a 3-foot trip.
Too much on the right side. Bilateral, roll back.
Let's do this.
Explantation of liver complete.
Grab your portion.
Collaterals appear hemostatic.
3, 2,
ES pattern.
1.
Adequate sinus rhythm.
Stanley, please.
Go
going on pump.
Hepatic vein patch holding. Flip distally and proximally, please. Pots and iris scissors on the tray. Got a clean one. Back table ready for reception. Excellent hemostasis.
Organs are fully functioning, ready to move to OR2.
Number 1 and number 5.
We are Audi 5000.
Number 1 and number 5 suture activated.
He's coding?
Airway patent.
Ivers, push 1 up epi.
No, you need to push bicarb.
Helen.
He's not going to make it. Push magnesium.
Dr. Sharp, it's their job to keep the body alive, not yours.
I need a sponge.
You're with me.
Place retractor. Maintaining.
He's got no pulse.
We need a defib.
Ready. Panel standing by.
Battles are charged.
Map and motor ready.
Clear?
No pulse. Go again.
Clear.
Half-inch Penrose drain.
I got a pulse. Normal sinus rhythm.
O2 levels are solid.
What was that about with Helen?
Screen for auditory stimulus.
You know it?
Yeah, they dated when I first got here for a couple of years.
Low gaze is ready.
Oh,
Dr. Reynolds, Dr. Wilder needs you in OR2.
I'm good.
1.5 mics per hour maintenance dose.
I lost the stomach. Fell apart while I was in the lower esophageal junction. It needs a full reconstruction by the time we reinsert, or I'll have to close without it.
Hey, is there a reason you think he might not live without a stomach?
Yes. It's looking like he's not going to have a small intestine.
Additional chilled HTK solution standing by.
That's the distal stump of SMB.
May I get a monochrome and a tapered needle?
You're getting perforation.
Yeah. Let me try anchoring in this flap. Damn it.
It's tissue paper.
I still need a stomach.
Then you're going to need to make one.
All right, switching over to plan B. A piggyback jejunal into position reconstruction. Now, not only is this complicated, but we're gonna have to do it twice as fast. So hands up if you've done it before. Any thoughts?
Well, the procedure I assisted on was led by Dr. Baptiste. He executed it flawlessly, and I believe he's in the building.
Okay. Someone page Dr. Baptiste. I need him down here stat.
The sooner we fix the problem, the sooner we can get to his reconstructive surgery.
Who cares if you're dead? It's how you look. Well, since you've given me nothing better, we're back to drugs.
The one thing we know it's not.
Decreased uptake on the membranous septum.
Could be an artifact. We can redo it.
But nothing's nothing. Do an EP study.
EP study means we have to stop this kid's heart.
I'll set it up.
House. Do you have a minute to be disemboweled?
I'm going to thread this catheter through different areas in your heart, and once I found the right pathway, I'll apply some electrical energy.
It'll stop my heart?
Sounds worse than it is. You'll be fine.
Is it gonna hurt?
There'll be some discomfort. If you've done drugs, I understand. Being different's really hard. Kenny, it's more important for you to get better than to worry about getting in trouble.
If I did drugs, that could explain my heart problem?
It could.
And then you can do the surgery to fix my face?
That's why we're here.
You know how famous people, everywhere they go, people are watching them, staring? They never have a chance to just be. You know? And a lot of them turn to drugs. People stare at them because they're beautiful, but me, they just stare.
You okay? I need to know what kind of drugs, Kenny, and how much.
Coke. Mostly a lot of coke. And then when I run out, I usually go to LSD or acid.
Those are the same thing.
They are?
You don't do drugs, do you?
I drank from my dad's liquor cabinet.
We're not going to do this test.
No.
I need you to turn on your side. We need to intubate. I need some help in here.
What was that?
It's power grid kicking in. We've been on generators since the explosion. Elevator should start up again in a second.
Why isn't it?
I don't know. Naomi, where does it hurt?
My neck.
Can you describe it for me?
It's tightening, almost like I'm being choked.
We saw the hematoma earlier, but I do see increased swelling right now. Likely residual effect from impact trauma.
What do we do?
Gonna be fine, okay? It's an internal hematoma, which is now swelling quickly.
A blast injury? Arterial?
A venous collection. And it aggravated when the elevator stopped. Dr. Bishop, if it's pressing on her airway... How long until somebody can get us out?
When the power came back on, the surge blew part of our grid. We got 2 elevators down, only yours was in use at the time. Mechanic was working with fire and rescue, but you're between floors, so it's delicate.
Sir, if the swelling continues, we lose our shot at intubating her.
Well, you need to be prepared to act before that happens.
You mean open an airway without imaging? Sir, even if I could approximate an incision point, I don't have the proper tools.
Well, let's hope it doesn't come to that. How fast is the swelling accelerating?
It's doubled in the last 9 minutes.
Well, if it keeps accelerating at the same rate, you won't have another 9 minutes.
If I don't make it, I need you to tell Jules. If I knew this morning was gonna be the last time, please tell her that I love her.
No.
What?
I'm not gonna tell your wife you love her because you will. You will. All I need to do is make an incision distally. Then I'll quickly insert a tube.
Dr. LeBlanc.
Poor hemostatic technique can increase the risk of internal.
Max!
So I have to be careful to apply pressure
Max!
proximally. What?
Where do you spend every waking moment of your days?
In this hospital.
Exactly. And when you're not here, what are you doing?
Reading.
Reading what?
Medical textbooks. I've read 3 studies on this procedure, and I've watched every video available online. You're the one always telling me not to overthink, but I'm ready for this because of all the work I've done.
I agree.
You do?
If I was stuck in an elevator with a hematoma, no imaging and no tools, I'd be lucky to have you there to handle it.
I'm gonna do it now.
Slow and steady.
Working. It's working. Her O2 sats are rising.
Hey, Daddy. Come and switch with me, man. I've done this before. I can help.
I can. These are trauma docs. We're all gonna help you. What do you got for supplies?
Yeah, I got everything. There's no anesthesia.
Well, I guess she's the hostage.
Show us what you got.
You can see the abdominal area is really swollen. I'm thinking there's internal bleeding.
It's likely bleeding out from the spleen.
Hey, do you have EMT experience?
Combat triage. I can follow orders.
Good. You're a soldier.
Yeah.
Clubs, move.
Sir, did you shoot him with an AR or with a handgun?
You gotta slow down. We're about to do surgery right here.
We're a shark. We don't stop.
Well, hey, pal. Nice to see you haven't changed. You got time
Time for an old buddy?
Oh, I recognize that voice. If you're calling me, you're the head of bank division. It's about time. It's always been your destiny. I guess you wonder why we're slowed down?
I'm actually wondering why you would ever put yourself in this situation to begin with, but sure, yeah, let's start there.
We're just trying to keep a cop alive back here. It's a little tense.
Camille can't do this. She's not a doctor.
Yeah, no shit, she's not a doctor. She's actually competent. Listen,
Danny,
I gotta go,
Danny.
but I'll drop you a line sometime. We gotta catch up.
Oh, yeah? Well, I got a funny feeling you're about to have a lot of free time on your hands.
Yeah, on a tropical island. I'll send you a postcard.
Yeah, who's the other guy, your driver?
Get a pen and a paper. Write this on it. Fuck off!
Poke a hole in the skin. Then take the scissors. I need you to open him up. Open the skin.
Got it. I'm going for the skin. Okay, I'm cutting. Cutting skin.
Out of the fucking way! Look, we're an ambulance!
Skin is open.
Then you and your criminal friend right there put both of your hands in the wound, and I need you to spread the muscle apart.
Man, the way people drive in this city.
Stop yelling!
Slow down. You cannot do this at 60 miles an hour. Just pull it like a rubber band. We have 4 minutes to 4 minutes.
Okay, and pull. Pull, 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 pull.
I need you to blunt dissect with your hand, right? All the way down.
Slow down, Danny.
Danny, I need you to slow down.
How about we all just get out and walk?
Danny, just give me 20 now. It's not the time to argue.
It's as slow as I go.
I need you to slow down, man.
Slower.
We're playing live operation back here. Just slow down.
This is gonna be the slowest cop chase in the world.
Crazy shit going on back here.
Okay, tell everyone to calm the fuck down. What are you doing?
You heard her, yeah, I can feel
And I
it.
need you to squeeze it now. Squeeze it hard. Just stop the blood to the spleen.
God, I'm trying.
You're doing good. You're doing good.
It's working, it's working.
Drop down to 20 miles an hour. Give him some distance.
She's operating on our brother right now. Yeah, his blood pressure's dropping. He's about to code. Palpate for the bullet.
You got it.
It could be a sharp object.
I can't find it. Oh, God. It's on the spleen. Colin, it's pressed onto the spleen. What do I do? What do I do? I've never done this
Cam,
before.
calm down. I need you to show me the spleen. I need to visualize it.
Look at me if you're just nervous, okay? I said you're just nervous. My wife, she gets nervous all the time. You know what we do? We breathe. We do it.
Okay, got it.
I think he's waking up. I think he's waking up. Oh, yeah, he is fully awake. Oh.
Hold him down. I'm in his gut.
Yeah, I think he knows.
Stop.
He's fully awake.
Oh my God, this is insane. This is...
Stop him, Will.
Trying to save you. Stop. We are trying to save you. Oh, go to sleep.
What are you doing? I let you back there for like 5 minutes and now you're punching the cop?
That worked. Is he out?
Yeah, he's out.
All right, listen to me. The spleen has an artery attached to the bottom of it. Need to pull it out slowly.
Pull the spleen, gentle. I don't want it to burst. Cam, you can do it, gentle. Don't let him die.
It's coming out.
Colin, if this spleen ruptures, he's got 60 seconds.
I'm gonna grab it. I got it. Okay, I'm taking it out. I got the bullet. It's coming out. Okay, I've almost got it. It's out. Oh, God. It burst. Colin, what do I do? I don't know what to do in this situation.
You gotta clamp that right now. He's gonna bleed out.
I used all the fucking clamps.
Hey, look at me. Listen. Do you know what we do? We breathe. Okay? That's all. We just breathe, okay?
I gotta clamp it. I gotta clamp on my hair. Grab it. Okay, you gotta clamp underneath. You gotta grab the artery. Fast. Oh, fuck. It worked. Oh, shit.
Did it work?
Worked. This shit is crazy.
Yeah, we're doing crazy today.
Does your wife know you're Rob Banks?
Why are you asking?
Situational awareness. That's all.
Let's tape him up.
It's okay. I've got this.
Boy, she was smoking. Collapsed with a blood sugar over 700. Took 100 units of insulin to bring her back.
So was the high blood sugar?
Well, we still don't know why it keeps spiking.
What if it's the smoking?
Yes, smoking's bad for you.
What if she has a carcinoid tumor being stimulated by nicotine? Just now when she collapsed, she was smoking. On the boat when she collapsed, she was smoking. What if the nicotine from the cigarettes is squeezing the tumor, making it kick out huge amounts of glucagon, and that is what is driving the blood sugar through the roof?
Well, I did a CT on Al's abdomen and her chest, and no tumor.
But all of her symptoms point to it.
Except it's not there.
So do exploratory surgery and find it.
Who does exploratory surgery anymore?
We do. When we know something's wrong.
Systolic 140, pulse ox 97.
Up on understood.
Lap span. Wet rapid pull tip.
You see anything?
Nothing.
We visualized the entire abdomen.
Yeah.
I can't believe we let Dr. Goodwin talk us into this.
He thought a carcinoid tumor fit all our symptoms.
Well, he was wrong.
Fresh ESU pencil on the tray.
I'm gonna run the bowel.
All 23 feet of it?
Yep.
Then you're crazier than he is.
There's a second graduate milligram per hour. Balfour retractor standing by.
She is so stubborn.
Show me a kid who doesn't think their parents are stubborn.
She's overweight, diabetic, and spends most of her time chain smoking, eating fried foods, and drinking. And she has no intention of ever changing.
That's problematic.
That's a recipe for disaster. I'm the only one telling her to stop. The rest of her buddies out in Sheepshead Bay, they all have the same bad habits.
Maybe they all need a little attention.
They need a swift kick in the pants. You know, I go out there as often as I can, prescribe them what they need, but it's just... it's not enough.
Found it. I'm gonna cut it out, send it to pathology.
Patient's fully anesthetized.
Paralytics?
On board.
2 units tacked and crossed?
Got him in the cooler.
All right, I'm done waiting for Jason.
Just give him a few more minutes.
It's an unstable fracture.
He said he'd be here.
We've been holding off all night.
Heart rate's dropping.
If we don't fix that fracture right now, he's gonna die. Let's go, Tom.
God, where are you?
It's called an anterior screw. We need to fuse the spine together, and I need to know immediately if the screw is out of alignment.
Yes, doctor.
If it's too far anteriorly, it'll pierce the back of his throat. If it's too posterior, it'll impale his spinal cord. Turning the screw. I almost have it.
Trajectory.
I'm almost there.
No, too anterior.
Damn it!
Jordan, I have to push another round of pancuronium if we're going to continue at this pace.
Then push it!
You can do this.
Hey, how's it going?
Where the hell have you been?
Sorry, I got here as soon as I could. How's Jordan doing? Should be a 2 or 3 hour procedure tops.
You're right. If you came when you said you would, it'd be over by now.
Yeah.
The patient would be in recovery, and we would be celebrating. All you had to do was show up.
Please.
You couldn't even do that.
Get the cart. No pulse.
Come on, come on, come on. Charge to 360. Clear.
VTAC.
Going again. Clear.
No change.
Give him an amp of epi right now.
Going again.
Dr. Cole, your glucose
Yes,
test.
yes, quickly. Get the epi in, now.
Bolus amiodarone.
Cleared for surgery.
Again. Clear.
Nothing.
Check the pulse.
No pulse. Asystole. Should we call it?
No, absolutely not. No.
Jason, it's asystole.
Go again. It's fine VFib. Let's go again. Ready? 360. Clear.
No change.
Compressions. 1. Again. Clear. Come on!
Nothing.
Damn it. Again. Clear. Come on, Roman. Come on. Come on.
Still no pulse.
Find VFib on the monitor. Going again.
That's 5 amps of epi already.
Clear. Text pulse.
Got a carotid.
All right, here we go. Let's place that screw.
Heart rate's weak. In the 40s. He's barely hanging on.
Standing around's not gonna help us. Give me more cephalad retraction. Retractor. All right, fluoroscopic image is up. What are you using for a screw? 4.5. Perfect. Away we go.
Hurry up, guys. Pulse is getting thready.
Turning the screw. All right, the screw is firmly seated.
Position looks good.
Heart rate rising. Patient stabilizing.
Hey, good job, everybody. All right. Guys, let's close them up. Jordan.
I think you're a little posterior. How's it looking, fluoro?
Give me a view at 120.
One sec.
All right, there. That's it. All right, we're almost there.
Hold on, heart rate spiking.
I can't continue if she says tachycardic. We gotta slow her heart down.
You gonna cardiovert?
No, this fur would never get enough contact with the skin. Marty, give her 6 milligrams of adenosine.
On its way.
Mean arterial pressure of 70, 60, 40. No pulse, heart's arrested. She's gonna come back, right?
Humans do. But this is the first time that I've given adenosine to a panda.
Got a pulse. Map back up to 50, 60. Connor, no good. She's still in SVT and her pressure's down.
All right, we've got no choice. We've got to try to cardiovert her. Shaver. Sync. Clear.
Still SVT.
All right, charge to 150. Sync.
Sinus rhythm.
All right, we're stable enough. Let's proceed.
Shouldn't you people be working?
They're treating a panda in the cath lab.
So much for non-disclosure. How's it looking?
Dr. Rhodes just deployed the ASD closure device. I always learned so much watching him.
لازم تشتغل بسرعة. You paged me? Patient is a 9-year-old girl, crushed lower right extremities. Sally called with a few questions. We really need your help.
What do I need to know?
هذا رفيقي Dr. Hunter. This is Sally. We work together in Syria.
Hello, doctor.
A severe soft tissue injury progressed by gangrenous limb. He's pulled over on the side of the road and needs to perform an above-the-knee amputation right now.
With what tools?
I have scalpel, scissors,
Hemostatic clips.
Yes. Dressings and a handsaw.
Ketamine for sedation.
Can you show me the girl again?
She weighs maybe 20 kilograms, Dr. Hunter.
All right, try 20 megs if you have that. 20 milligrams.
Done.
Okay, Soleil. If the tourniquet is tight, make your incision. Start by dividing the skin circumferentially.
قبل ما تقطعها قص الجلد بشكل محيطي. Good. Now cut through the subcutaneous tissue.
Okay.
You're doing great.
في كتير دم ما عم بقدر اسيطر عليه.
خليك هادي يا اخوي. تأكد إنه الرباط مرتخى. شوي شوي.
Room 305.
You've got to go to that bash.
I can't leave him.
Soleil, you think we can do this? Just you and me?
Okay.
Well, no, something might get lost in translation.
Bash. We got this, okay? Go.
Thank you, Theo. أنت بعيادة أمينة.
I finished sewing. There's blood everywhere.
Tighten the tourniquet. Apply the hemostats to the longitudinal structures that are likely to be the major blood vessels.
Hemostats do. I'm sorry.
It's the structures that look like... So, the leg, the blood vessels.
Blood vessels, yes.
Okay? Yes, the structure of the blood vessels. Try again. Keep at it. Show me.
Here. Did you see it?
Good.
What do I do now?
Okay, now keep the tourniquet in the position and
Okay.
just examine for obvious blood vessels, then clamp with your hemostats.
Okay.
That was fast. She's okay.
Dr. Hunter, there's oozing.
No, that's normal. Just keep an eye on it. Yeah, if it continues, you just need more pressure on the dressing.
Thank you. Thank you both.
Well done, Saleh. What the hell's going on here? 9-year-old Syrian female crushed lower extremities after a building collapse. Rapid onset of GFM after tourniquet and rescue.
A volunteer medic successfully performed a roadside amputation with almost no equipment.
Prognosis? She's responsive and stable. He saved her life. Good. Find me before you leave.
Who was that?
The big boss.
Call me when you get to the hospital, Saleh.
Mesh.
Yalla.
You do the kind of thing a lot?
Not anymore.
Cooling jackets prepped?
Standing by.
Then let's do this. Scalpel. All right, go on bypass. Cool to 20, but do not crash cool. Find me when it gets to 32 degrees, and we'll arrest the heart.
Yes, Dr. Roth.
Where are we?
Body temperature's at 20 degrees Celsius.
Flow down. Clamp.
Clamp.
Clamp is on. Give cardioplegia.
Please on. Heart's arrested. Start the clock. Stage is yours, Dr. Rhodes.
Mets and DeBakey.
Here, doctor.
Time? 6 minutes. Precisely. 6 minutes, 11 seconds. You still have another layer to go.
Damn it, more suction.
You have a clear line that the vessel suction is not your problem. You're not gonna make it.
I have plenty of time.
Not at the pace you're going. You've done 57% of the work and 81% of your allotted time. You are not gonna get there.
Your nonstop number crunching isn't helping.
30 minutes. That's what we agreed. That's what you promised. I'm taking over. Step aside, Dr. Rhodes.
I can do this.
Step aside.
Downey may have been quick to put his faith in you, but my faith takes longer to earn.
His blood pressure's dropped. Down to 90/64.
Hang in there, Hugh.
Is that a fence joke?
Just keep talking. Make a list of all the things you're gonna do with your husband when you get home.
What's his core test?
Scrub the baseboards, fold the towels. Though Eric always says 3 folds is overkill.
Eric can have an opinion on 3 folds when he starts doing laundry.
Good point. You have to help me remember to tell him all this if I make it.
You're gonna make it.
BP's dropped 82/40. We need to do something now.
Hypothermic coma. Lowers body temperature near freezing and slows metabolism.
Wasn't I freezing outside?
Oh, no. This will be controlled. I'm afraid it's our only option.
Respectfully disagree.
You bring me some power?
No, but we can do his surgery right now.
What?
We have all the equipment we need here. I worked in far worse conditions in Afghanistan.
Dr. Candelario, this is my patient, my OR.
Your OR has decent lighting and electricity. We can save this man. But I'm gonna need you to let go. Literally.
Go ahead with the IV, it'll help keep these.
Right ventricle's exposed.
Lung sounds bilateral.
In a traditional surgery, this is where I'd stop the heart from beating.
But we can't do that.
No, we can't.
37 degrees.
You've been holding the heart for a long time. Perhaps you've got the rhythm down, right?
You want me to time each suture to the relaxation phase?
Exactly.
All right, keep me updated.
Time to let go.
Can you slow him down a bit more, Alicia? Give me time to sew.
I'll try.
Kat, I'm gonna need a 3/0 Proline on a needle driver.
You're doing great.
It's not much different, actually. I mean, it is, but I never realized how much I relied on machines. Doing it old school like this makes me think I might be a better surgeon than I thought. Oh, no.
Alicia?
Oh, what are you?
Alicia!
Alicia, get him back up there! His heart's racing.
I'm trying.
We need blood. Oh, Ned.
There isn't any. We exhausted the supply earlier tonight.
Then find some. We're not losing him.